Yeah, well, hello, good morning. So, I hope I'm audible for you. So, please let me know, is it clear or can you able to follow me? See if you could send me some messages, whether it is clear or can you please share me that? Well, hi Anshu, hi Ants, Pratipa, good morning. Binsi, hi, Shiny, good morning. Jija, good morning. Sini, good morning, good morning. Oh, thank you, Shiny. So it is clear, audio is okay. Alright, so today we are here to discuss about OET speaking strategies because most of the students are much of worried regarding their writing, reading or sometimes listening as well. And speaking has been another very important subtest which you need to focus on your examination because within short time, that is approximately 20 minutes time, you can score maximum with your speaking. If you could focus a little on your speaking subtest and the practices, definitely you would have been scores much on your examination. So today we are discussing much about how you have to focus on your speaking subtest and what are the tips and strategies it could help you to score maximum on your examination. So this is all what we are trying to discuss here today. Eldos, yeah, thank you, Eldos and Swati, Pramod, hi, good morning, all. Xenia, all right, there are some distractions in here. All right, I hope it is clear now. Well, good morning, all. Okay, so as what I said you before, like today we are totally focusing on your speaking and how you have to face your examination. What are the criteria which they are assessing your exam, or how you have to focus on your role play. All these aspects we are discussing today. And if there is any concerns, if you wanted to ask me, definitely I'll give some sessions on at the end of the end of this live. There you may ask me a lot of questions, and definitely I hope I can answer for everything. And fine, shall we begin? Okay, so basically the speaking subtest, which takes about approximately 20 minutes, all right, so which is including your warm-up sessions and your basic interviews, like kind of an introduction, your document verification, all it's together will have 20 minutes time. And you will have two role play, which is totally based on your profession. And for example, if you're a nurse, definitely your task which is related to your nursing profession, and if you're a doctor, your task will be based on your doctor medicine profession. Since you know that there are 12 healthcare professionals are taking this OET examination, in which all they have your reading and listening will be same, and writing and speaking will be according to your profession. So your speaking will be based on your professional base. Even if you are a nurse, you will be getting according to that profession questions, and if you are a doctor, you will be getting according. And as for you will have your pharmacist, physiotherapist, many kind of healthcare workers are taking with this examination. And you will have two role play, all right, so you have to complete this two role play based on your typical workplace situations. And in each of the role play, you will be expected to demonstrate a proficient communication skills. So here your examiners will not be getting into assessment of your professional knowledge, and here is only they are looking for your proficient communication skill in all the situations that you are going through. So you have to base according to your specific profession that you need to work on it, and this is what something which we are looking forward. And Christo, good morning. Bonsi, good morning. All right, so This is what you need to focus on when you are, because much of the students are conscious when they are trying to speak about their speaking subtest, but here actually you need to speak in a layman language. So definitely you need not to include any of your professional aspects to your speaking subtest. That is all the reason, because you need not to worry about how much you knows about the medical condition which is given on your role play card. All right, so as I have mentioned already, please be listen carefully that your professional knowledge is not going to be assessed on your speaking examination. How you could convince your patient, or how you could have a conversation with the native speakers, all these your way of speaking, and as I have mentioned, like there will be some criteria to evaluate your examination, and based on this criteria will be assessed your examination. It will not be based on your professional knowledge. So even though if you have no idea regarding what was the medical condition, but doesn't need to worry regarding, because you need to explain according to the task wise you need to give, and it's been very important that you need to have a clear idea about the descriptions which is given on your role play card. So that has been very important. So first you have to since you know that you will have 3 minutes time for your preparation time, during this preparation time it's been very important that descriptions and the task you need to read it carefully. Alright, if you are reading that descriptions carefully, you will get a clear picture about what is your patient and how you have to talk to this patient and what kind of setting on your speaking role play. So as you know that there will be different settings on your speaking role play. So firstly, hospital ward, emergency department, burns unit, maternity department, all these kind of different settings you will have on your speaking role play card. And based on this role play situations or the settings, you need to understand whom you are getting into the conversation, or how you need to talk about the patient, because as you know that when it comes to the different situations, you have to make the conversation according to the patient's emotional status, or patient situations, or medical background, all these aspects which you need to focus on every time. Then only you would be able to provide accurate speaking, and you could score maximum on the subtest. And in my experience, many of the students are focusing this examination as something like they are talking to an interlocutor or the examiner as kind. But I should give you a guarantee that if you are considering that you are having a conversation with your interlocutor or your examiner, definitely you will be in trouble to provide, or many of the students will not be able to provide the accurate or the more effectively they can't provide that. So always try to consider that you are a nurse and you are talking to a patient, and patient doesn't have any idea regarding his medical aspect. Then on this conscious mind will help you to provide the maximum stress on your the conversation, and never try to keep like you are an OET candidate and you are taking your exam, and if so definitely you will have some problem. For example, if your patient is asking some questions about the medical condition, definitely you would have been explaining more than what he is expecting, right? Similarly, the same questions asked by your physician or some doctors or your superiors, even if you well knows about the subject, definitely you will be in kind of a shattering, like, or you will be in trouble to explain all those aspects. So always try to consider that you are a nurse and you are talking to a patient. Then that aspect will help you to complete your conversation, and you could finish your things, and you could provide maximum effort on your speaking. All right. So another misconception by the students, they have to speak all the 5 minutes during your examination. So basically, it is not being evaluated that have you spoke the whole 5 minutes during your examination. It is looking only that whether you have convinced your patient. So for a better evaluation, you need to speak at least 4 minutes of your time, and it has not been highly mandatory that you need to speak the whole 5 minutes with your whole task. It is not necessary. So you require that you need to consider all the tasks, and if you could speak at least for 4 minutes and your patient has been convinced, then you can stop your conversation. And if you feel like you have completed all the information which you wanted to share to your patient, then you can do that. All right. And to complete your role plays, you interact with your interlocutor who takes on the role of a patient, or in some cases patient carer or relative. That means So you will be taking a role of a nurse or a doctor. That means your professional role you will be considering, and your interlocutor will consider a role of a patient or perhaps a relative. All right. Sometimes he will be acting on a relative, or sometimes he will be as a patient. So doesn't worry, you can make a conversation and you can have a conversation as a nurse or as a doctor, as based on your professions. All right. And you always take a role of your profession. For example, if you are a nurse, you will be taking a role of a nurse every time during your role play. And your role play is related to a real life scenario. So as I mentioned, that your interlocutor will take a role of a patient or perhaps a relative. So here it is actually a real life scenario that you need to face in a specific healthcare field, and you are expected to demonstrate range of communication skills. So there are a range of communication skills which you have to have when you are making this conversation. So we'll just look into what are the criteria or what are the things which you need to focus on when you are making a conversation. The first thing, eliciting information from a patient using open and closed questions. Sometimes we are more encouraging the candidates to use open-end questions, and sometimes you also require to have a closed question. Here we have mentioned a phrase that is eliciting information. So what do you mean by eliciting information? Eliciting information means it is nothing but you have to get the idea of the patient. All right. For example, you told to your patient like you have anemia. All right. So now you may ask a patient what extent you knows about anemia, or do you have any idea regarding what is anemia. So when you are getting the information from the patient, there we could say that it is something is eliciting information. All right. So that what you need to do it first. And then seeking clarification when the patient's statement is unclear. If you wanted to have a more clear picture on the patient's symptoms or patient disease condition, so you would have been asked for more clarification if the statements are unclear, and explaining the investigation, diagnosis of the treatment using the language that the patient can understand. Many of the time, all the healthcare professionals tend to speak in the medical language. So if you are using all this medical language, then the patient may not clearly understand what exactly you are trying to talk, or the explanation would require more rounded. For that reason, what do you have to do that if you wanted to explain in a proper way, like you wanted to explain the investigation, diagnosis of the treatment plan, if you wanted to ask or discuss with your patient, then you need to explain in a layman language, because since your patient doesn't have any medical knowledge regarding on it, so you have to explain in all these in a clear manner, and offering reassurance, warmth or comfort to anxious or agitated patients or their family members. So usually we may expecting three kinds of patient. That is a normal patient, that is a patient can understand all your suggestion, and second thing is that your patient might be reluctant throughout your conversation, maybe or partially, or your patient will be aggressive or agitated. All right. So these three kind of patients you may experience throughout your conversation or during your speaking practices. So what we can do when the patient is in a normal stage? Nothing you need to do that, just you need to reassure your patients with whatever the suggestions you are providing. If the patient is reluctant or the agitated or aggressive, then you have to make them a cool, or you have to make them to, or you have to divert into a normal situations, or you have to tackle the situation. Then only you would be able to complete, or the patient will be get convinced during your conversation. So you have to make sure that every time you have to tackle the situation, how you have to focus on the patient's idea or patient situations, emotional background, all these things you need to respect, then only you would be able to do it. All right. When you understand this, your empathetic conversation or empathetic ideation would be most important. So what kind of empathy you need to provide? Because most of the people knows that, okay, I have to talk in not in sympathetic way, I have to talk in an empathetic way. But what are the empathy? All right. So what do you mean by empathy? How polite you need to speak in during the conversation, or all these idea will definitely you will have. But obviously you also need to understand what kind of empathy you need to provide. There are three types of empathy focusing on the healthcare system. That is first thing, cognitive empathy. So what do you mean by cognitive empathy? So cognitive, definitely you would have been understand thinking. All right. Your thinking process would be more focusing on the cognitive. So when you wanted to if you see a sick patient, what do you have to do? That you need to try to understand the illness. All right, try to understand the illness rather to engage with their emotions. All right, so always you have to think about how the patient's illness is now, or if you were in the situations, definitely how you will be take up with this kind of medical condition. All these you need to think about, then provide the care. So if you feel your patient's situations require some cognitive empathy, then you have to think that you were in the patient situation, then how you will be following or how you will have these kind of emotionals. All these you need to understand. The second type of empathy, that is emotional empathy. All right, the first what we discussed, that is cognitive empathy, and second one we will be discussing on the emotional empathy. When it comes to the emotional empathy, you should understand what is happening with someone else. All right, so what the patient is having. For example, when you are trying to insert an IV cannula, you will be having hearing a sound of that, how the needle is peering into the skin, or how they are getting introducing into the skin. When the skin is being incised, you will get some sounds. Or some people often told me, even my friends, they were telling me, so when the cannula is get inserted, or when the incision has been made, so they will feel the incision has been made upon their body. All right, so these kind of feelings will be there. So when you have to understand how emotionally the patient is upset, based on that you need to provide the empathy to the patient. And the third one is compassionate empathy. When it's the compassionate empathy, it is not like emotional empathy or the cognitive empathy. You need to act upon the patient situations. All right, so it will be not that you are recommended to be understand you are on the patient situation, so you are emotionally how the patient will be take up. It is not be recommended to do that. You have to understand the patient situation. Immediately you need to act on the patient problem. For example, your patient is asked that he is having a severe back pain. All right, so rather you are putting emotional aspect on it, or rather you are thinking on the patient situation. What you have to do, that you have to act on the patient situation. There your patient will be more get the empathy from your side. All right, so this is what you need to understand, how you need to focus on the situation. And the next thing is that providing advice on lifestyle, health promotion, and managing risk factors. So when you are explaining all this to your patients, you should understand what is the patient's lifestyle and how the health promotions, or how you have to explain to manage the risk factors that is relevant to the patient's circumstances. So never be generalized when you are talking to a patient. You should understand what is a patient lifestyle, what's a patient health promotion, how he has to manage his risk factor. All this based on the patient's circumstances, you need to explain to the patient. Then you have to go for adapting speech when interacting with the patient's different age groups or different patient types, that is uncommunicative or irritated. All this situational wise you have to understand based on the patient age. That means the way that you are talking to a child, it is not like you are an elderly patient. All right, well, if the patient is uncommunicative, patient is not interested to communicate with you, or he is irritated, it is not the way that you are trying to talk with a normal patient. So you have to understand the age group and the patient's willingness to talk, or whether he is agitated or irritated. All these factors you need to understand. All right, and as I mentioned, there are two sets of criteria we have. The first one is linguistic criteria, and the second one is clinical communication criteria. So when it comes to the linguistic criteria, the word linguistic itself you will be able to understand. All right, it is totally based on the language. All right, so here there are 4 sub criterions you will have on your linguistic criteria. 6 marks you will be getting each of the criteria if you are implementing all these criteria. So we will be looking into what are the criteria now. All right, when it comes intelligibility, the intelligibility criteria which is showing, there are so I request all to send some questions if you have at the end of the sessions. Otherwise we might be missing your questions, and we couldn't be able to convey all the answers for it. So at the end of the criteria, we'll definitely discuss about what are the questions or what are the concerns if you have. Alright. The first linguistic criteria, that is intelligibility. Second one is fluency, and third one is appropriateness of language, and last one is the resources of grammar and expression. When it comes to the intelligibility, what is intelligibility? Alright, when you're considering a conversation, you should look for what are the tone, rhythm and intonations you have to focus on your speaking. Alright, so on different situations and different emotion and different patient, medical condition, all this we are trying to talk when during our conversation. Here, you need to focus on your tone and rhythm based on the patient situations, emotion, all these aspects you need to understand. When it comes to the second criteria, that is fluency. What do you mean by fluency? That nothing but it is flow of your language. Alright, and never you try to speak in too fast or too slow, because if you are in too fast, then the listener may not understand exactly what you are trying to talk about. Alright, and if you are in too slow, your listener will be distracted from the exact point what you are trying to convey. Alright, so that is something is the flow of the language. So you should always look forward how you are fluent enough when you are talking to a patient. Then you have to look for the appropriateness of language. So since I have mentioned already, you are talking to a layman. So when you are talking to a layman and you are focusing on the medical language, then the patient may not understand exactly what you are trying to talk about. So you always try to understand you are talking to a layman and you have to explain in that kind of way. For example, even if you want to explain in a medical language or medical template during your conversation, then you are liable to explain in a layman language as well. Alright, this is also you need to focus on it. Then resources of grammar and expression. Resources of grammar has been very important, because unless if there is no grammatical structures on your conversation, then it has been there are high chance to lose your marks. So always try to understand what the grammar you are trying to talk about on each sentences. And expression, it is not the physical expression, you need to focus on it. Your voice modulation, you need to modulate according to each of the situation of the patient. Or if the patient is quite depressed, your language is according to that. You have to understand each of the patient's problem, your perspective and everything you have to understand. Based on that, you have to express your gratitude or your sadness and everything you can express through that conversation. Alright. So this is all about the linguistic criteria: intelligibility, fluency, appropriateness of language, resources of grammar and expression. When we move on to the next sets of criteria, that is clinical communication criteria, which marks on 3 of each of the criteria. Here first we are trying to talk about relationship building. And second one is understanding and incorporating the patient's perspective, and providing structure, information gathering and information giving. So these are the 5 sets of criteria which has been focusing on the clinical communication criteria. When we focus on the relationship building, firstly we have to understand we should greet the patient according to the time of the situation, like good morning, good afternoon or good evening, according to the time of speaking or the settings. You have to understand. Then you have to introduce yourself. So it has been very important, because some students will forget to introduce themselves to the conversation. So it has been very important that the patient needs to understand to whom they have to making the conversation. For example, when we are talking to a dietitian, we will be talking only the related matter, that is the dietary requirement, your dietary problem, all these things you will be asking to the dietitian. And whereas when it comes to the physiotherapist, you will not discuss any of the dietary requirements to the physiotherapist, right? So you will be asking all the physiotherapy exercises, all the matters to the physiotherapist. So you should understand, when you are trying to discuss with a patient, you should introduce yourself to the patient. There is only one exemption, that which you can avoid the introducing yourself to the conversation, that is if the patient is known to you, then you can avoid using all this introductory thing. Otherwise you have to have an introduction session when you are doing with the conversation. Then you should understand the nature of interview. So what is the setting and how the patient's emotion, or what is the medical condition, all these things you need to understand. Then only you would be able to provide an accurate speaking on your conversation. And then adopting a non-judgmental approach. All right, when you are trying to talk about, you should understand non-judgmental approach to the patient. So if you are keeping one thing or keeping a conclusion on your mind, if you are talking to a patient, that conversation will not be convincible. So you have to try like you are onto a non-judgmental approach. Then only you would be able to understand the proper situations to the patient. All right. And when it comes like you are understanding and incorporating the patient perspective. So many patients will come to you with different perspective. All right. So based on each of the patient's perspective, you should understand it. Then only you should provide the conversation to the patient. Otherwise, it will be a non-situational, judgmental speaking will be. All right. So you should understand the patient perspective. For example, your patient is in some stress, and that is the reason because he is continuing with his smoking habit. All right. And if you wanted to ask him to stop the smoking habit, and if literally you are suggesting that you have to stop your habit of smoking, this will be a judgmental thing. All right. And you are not understanding the patient perspective. Instead of, you should ask why he's keeping the habit of smoking, and then according to the situation you should understand why he's keeping his habit of smoking, and based on the situation you should give a solution for that. For example, if the patient is in stressful situations, what do you have to do? That you should ask them, or you should suggest some situations, or you should suggest some way that he should come out of his stressful situation. Then only you should tell him that it has been something is very complicated, that if you are keeping his habit of smoking, then you should suggest him what are the way that he could come out of smoking habit. All right. So you should understand always the patient perspective. Then only you should provide the conversation to the patient. Then providing a structure. For example, you should explain him what the way that you are trying to talk about it. What are the things you are trying to talk about during your conversation part. So there are many aspects like signposting, chunking, all these aspects that you would have been give the structures on it, and some signposting, for example, some explanation how the impact will happen if he's keeping the habit of smoking. Because in my experience, I could say that many patients, they had similar problem, the similar habit, and finally they lead into some other complications. So all this complication pattern you can discuss with your patient, so the patient may understand easily what would be happening if I'm keeping my habit of smoking. All right. So these kind of things you can explain while during your conversation. And then information gathering. If you came to know that the patient is having cancer, all right, so what are the questions you need to ask? So it is always better during the information gathering if you are keeping an open-end questions or leading questions. So this will keep the patients to understand exactly what I have to talk about. For example, so what do you mean by open-end question and the close-end question? So if it is an open-end question, you should, for example, could you please explain me what are your dietary pattern? All right. Instead of, when it comes to the close-end question, for example, are you vegetarian or non-vegetarian? So obviously the patient answer will be either vegetarian or non-vegetarian. But when it comes to the open-end question, if you ask the patients to describe about his dietary habit, he has to explain what are the diet he prefers to have, or what he includes in his dietary habit, or when he is trying to take the food, and what you would like to add in your diet. All these kind of things you will be detailedly explained. So this will make the active communication or two-way communication will be more relevant. Otherwise you will be talking much and the patient is less talking, so that has not been good enough to have a good conversation. So always try to keep the questions ready when you wanted to ask something particularly. So this will help you to identify, or this will help you to get the more on questions and the answers from your patient, and this will have a good conversation, and you will have more chance to get your maximum scores on your speaking. All right. And finally, you have to get the information giving. So what do you mean by information giving? It is nothing but you have to provide the suggestions according to the patient's concerns or the problems what you have gone through with your examination. All right, so this you need to focus on it. So when you are keeping all the questions on the patient also will answer according to your question, and based on you need to give the information giving, or you have to give the suggestions giving, and each after the suggestion it would always better if you could confirm whether the patient understood or not. All right, so by asking how does that sounds, or can you able to follow the instructions what I have discussed with you, or how was the discussions, would you feel like you can follow all these instructions what I have given, all these kind of the way that you can confirm whether the patient have understood clearly with your instruction, or this will help you the patients to have a clear picture on it. All right, so this is something is being very very important. And these criteria you should understand before doing an every speaking, then you can implement all these criteria which accordingly which is required on your speaking. All right, and even when it comes like in our speaking, many people are focusing on the accent. All right, so actually here on your OET speaking subtest, it has been not like looking you need to adopt some accent like native accents to your speaking conversation, actually which is totally required what the accent you have. Like for example, since you are an Indian, so you can have an Indian accent when you are trying to speak about. If you are trying to adopt the accent which is not been familiar for you, so that will be make you on the trouble on when you are on the speaking day. All right, so try to have your own accent and maximum explain very clearly, and you should speak openly and clearly with the accuracy of the language, but primarily on how effectively you could communicate in real life work place context. All right, it does is true that the use of true role play, in other words accuracy alone is not enough. As a healthcare professional, you are expected to have a strong communication skills that are necessary to ensure the compassionate and clear understanding of the patient's needs. As I have mentioned before, your professional knowledge is not being assessed on during your conversation. It is always trying to assess how enough you would be able to conversate with your people, or with your conversations ability on your structures. All these aspects are looking more on your conversation. So when we think about how to have your conversation, always try to focus on how you have to speak, or consider you are in the real life scenario, that is you are talking to a real life patient. Never consider that you are talking with your trainer or you are talking with your examiner. If you are considering, that will keep you in trouble. All right, and next one is your professional knowledge has not been assessed, your communication skills, how you could speak with your native speaker, how you could convince your patient, how you could use all the tasks which is given on your speaking questions. All these consider to how you are maintaining the conversation, and throughout try to use all kind of intonations how could help you. For example, all right, when, okay, and okay, all right, all these kind of intonations or the filling words you could use when you are on the conversation, and this all could help you how to have a conversation. All right, and this is all about your speaking. And there are many reassurance questions or reassurance problem will the students will have when during the conversation. I can give some extra points when you are on the conversation and you have enough time further and your task is already finished. So you can talk about the diet. All right, so when what you can talk about the diet, for example, you could say that on your medical situations you are required to do follow some particular diet, and which I can give you some brochures regarding on it. And if you could follow this brochures, definitely you can have a healthier diet, and which will help you to enhance your recovery at the earliest. You can do this. And similarly, your physiotherapy or exercises, daily exercises has been another important factors which I have to discuss with you on the situation. How will you do this? So you could say that there is another important factors which you need to focus on it, that is you have to do daily exercises. So how you need to do daily exercises? I can make an appointment with our physiotherapist. I believe he could help you better, and he will tell you what are the patterns of exercises you need to do in daily basis. And another important thing is that, another important point is that you need to have your medication regularly. All right, so till your next review, your doctors recommended to have your medications on time, which will also help you to enhance your recovery, what you are expecting before that you can have your recovery. And additionally, plenty of oral fluids, adequate rest, all these kind of extra points which can add in any speaking role play when you are on the examination. So if you feel like you have enough further times, because you have all completed everything, and you can have another trick when you are on the things, you can paraphrase your conversation and you can sum up the conversation, and this will help the patients to understand more on what are the things which you have already discussed. Alright, so this is a way that you can enhance your speaking when you are on the examination. Is that clear? Alright, now if you have any kind of questions, you may ask me, so we can have discussion. And one of the common questions when the students are always asked, when the description says that you have just examined your patient, whether you need to consider it is a known case or an unknown case. If the description says that you have examined the patient, it doesn't mean that it is a known case for you. Alright, so you should consider it is an unknown case. And the second question on the same question, that is whether we need to examine the patient or we need to consider we have already examined the patient. I always go into a tricky way. For example, if you have less tasks after the description, then you can do that. You can have an examination, and based on the examination you can explain it in detail. Alright, and if your description says that you have examined the patient, then after the description, if you have long task which is given below, then it has been recommended that you say, like, upon my examination I can see so and so things, and then move immediately to your further task. It is always better. And if you consider, if you have a description says that you have examined the patient, never try to always consider that you have examined the patient, now you need to go further. So what will happen if there is less task? So you will not have anything to have on your conversation. Alright, so try to understand what exactly you need to do, or what the situation, if the patients require any more examination, or if you have to have conversation much on, or if you need to explain in very detailedly. All these situations makes you understand whether you need to do the examination or whether you need to skip the examination, or consider I have already done my examination upon my examination. And if it is says like you have examined your patient, it doesn't mean that the patient is a known to you. Alright, if the description says that the patient comes for review, what we can understand? We can understand this is a known case for you. Alright, there you can eliminate your introduction part, like so and so the register nurse who will be taking care of it today. You can avoid this. Alright, and you can continue further things. Alright, and some of the common questions are like whether should I need to ask a patient's name, or literally I should consider a patient's name. Alright, always try to ask the patient name if there is an unknown. And where we need to ask, either you can ask during your preparation time or during your presentation time. On the initial part you can ask your patient's name after introducing yourself. So it is always better, it is a good manner that if you could introduce yourself on the first of your conversation. For example, good afternoon, my name is Varghese Thomas and I am your registered nurse to take care of you today. You can do that. Alright, and some of the students are keeping the same kind of an introduction for both role plays. So it is not so good if you are using the same the way that you are introducing yourself to the patient. It is better if you could paraphrase your conversation structure when you are on to the both role plays. Done? So I think it's been clear for you. So if you could have any kind of concerns, please ask me now so we can have a discussion on it. So another more important thing is that some students have a habit of asking to your interlocutor, how was my speaking, will I be able to get my B grade during the examination? So basically the interlocutor has no roles in your assessment. Alright, so they are not putting your marks, they are not putting any assessment during your conversation. So just they are the peer person for your speaking only. They are not having any kind of role in your conversation. So please don't kind of ask such kind of questions during your examination, and don't even expect like you have done better because your interlocutor have told you have done the best on your speaking day. Alright, so try to put your confidence on your speaking, not with your interlocutor. The interlocutor is just a person who is providing or helping you to have a conversation, that's it, because since he is taking a role of a patient or perhaps a relative, and he is not the person to assess your marks on your examination. So literally your OET is assessing your evaluation. There will be two examiners. They will be assessing they will be hearing your recordings, and based on that they will be putting your marks. So it is not like someone who's sitting on your exam, he is putting your marks. So definitely you need to understand that this is a real fact when you are on your examination. So is there any questions you have? Please feel free to ask me if there is any question, so I can discuss with you now. Yeah, Amulya, Pranav, how to improve your speaking skills. So here there are many ways that you can improve your speaking skills. So firstly, when you are trying to talk about, you have to understand to whom you are speaking with, alright? The patient situation, emotion, these are all things you need to understand. And some of the sentences that you need to clearly frame your structure of the speaking, and avoid all kind of incomprehensive sounds during your speaking, like all these kind of incomprehensive sound, you need to avoid it. And moreover, that you need to have your daily practice on your speaking, and watch many videos which is on the OET official site that you can have to improve your speaking. And PR speaking is always very important, that you can have have your conversation with your friends even, and understand that you consider that you are the interlocutor and your friends become your nurse. And after that you can understand how the interlocutor is expecting that your conversation, and you need to improve your task, and write and practice, keep some keywords on your cue card. This will also help you to identify or to improve your skills on speaking. Alright, and within 4 minutes my conversation got over. Should I stop there or should I continue summarizing the topic again? Always it is important that even just imagine you have understood that there are times ahead, alright? Then what do you have to do that? It is always ask your patient, do I need to discuss you with anything more, alright? Or would you like to share with me anything else? You can ask about the patient. And if there is any concern, you can go according to that, or else you can summarize your topic by paraphrasing your conversation so far what you are given, alright? And you can add on some other points what I have discussed, like diet, exercises, medication regularly, plenty of oral fluids, adequate rest. All these can you can include whenever you require to the topic. And it doesn't mean that you have to talk only which is given on your task. You can add on some points which is relatively relevant to your conversation, that you can add on it, alright? And if you have a last task to take consent or scheduling an appointment and time is up, how will close a conversation? So it is always better, thank you, by saying thank you, that you can end up your conversation. It is been not recommended after your interlocutor is asking, that is the end of your session. It is not been recommended that you need to continue your conversation. So it is, as I mentioned, that it is not been recommended that you need to complete all the tasks. So here we are focusing only that your continuity on the speaking, your fluency on the speaking, and whether your patient could convince from your conversation. This is all the things are evaluating your examination. It has been not like whether you have completed all the tasks, have you spoke with the 5 minutes. All this not been getting into the assessment on your conversation, how your patient is being convinced or not. If the patient is convinced by your 4 tasks out of 5, then it will be not a matter that you can do that. And since you have to understand, you have 2 role plays, and if something has happened on your first role play, you can manage with your second role play as well, alright, that you can do it. And how to reduce stammering problem, alright. So Pramod, it will be continuous practice. Something can manage with your any difficulties. For example, kind of a stammering. As I mentioned, like some people having more on incomprehensible sounds, like all these kind of things will be doing on this. So it's been always better if you could practice much on how you need to focus on it. And the second thing is that never consider that you are talking to your interlocutor or your examiner. So consider that you are a nurse, alright? Keep a confident like you are a nurse and you are talking to a patient who doesn't have any medical knowledge or who doesn't have any idea regarding the current situation. So you will be heading the conversation. So that confidence will keep you that to avoid all these kind of a stammering or incomprehensive during your conversation, alright? Okay. Is there any other questions you have? So please find to ask now, so we can have a discussion on it, because many other people can also have clarity with that kind of things. Okay, I think there is no other questions more. So if there is any further concern, you may please find time to ask with your trainer, or Jeremy is always there to help you. And since you all know that Jeremy is now at Calicut, so it began in the Calicut and now which is extended to Kottayam and Mysore as well. And we are yet to start in Cochin and Kollam further, definitely, because many people are requesting us to begin in Cochin, because there are many candidates waiting for Jamia. So I'm very thankful for that. And always, if there is any concern, please find time to contact with Jamia. Our executives on trainers are always there to help you. And there is another question. So can you clarify on summarizing, concluding without repetition? Oh well, so there are many people are understanding either there is a summarization, means the same thing what we discussed already, which you need to copy it and communicate again. It is not perfectly, alright. So for example, you ask the patients to follow a adequate or nutritious diet, alright. So how could you can summarize or paraphrase in another way? So I just wanted to explain one more thing very importantly, since we already discussed, that is your diet, alright. So in my experience, I've seen like the people who are following a proper diet, so they will be the recovery will be very soon, alright. So what are the importance of, what are the way that it has been getting importance when you are focusing on the diet? All these things you can explain it regularly, so the people, the person who is listening you, they will also understand what is the importance of the diet in this current situation, that you need to explain. Or you can explain the complications if he is not focusing on the diet, all these factors that you can understand. I hope it has been clear, Arun. This is the way that you need to never try to copy the same sentences to the summarizing part. You need to sum up based on paraphrasing the situation. Alright. So is there any other questions here? I'm not the right person is a common mistake the students make. So can you please? Oh, definitely. So sometimes until another the task says like you are not the right person to provide a medication, better you can continue the same things, or you can confront in the same things, or else it will not be so good like I'm not the right person to provide so and so things, because you are the professional person and you are talking to the patient, and the patient consider you are the right person to talk about all those aspects, all those concerns he has. Alright, in this situations, if you are talking like I'm not the right person to have a conversation with you on the situation, so that will distract the patient from your ideas. Alright, so what you have to do is you have to do on your such kind of a situation is that I can make an appointment with your doctor. I believe he is the right person to help you. Alright, so you can paraphrase accordingly. Is there any new updates in speaking? So far there is no new updates on your speaking. So only thing is that you need to understand the situations and do accordingly. That is the only things you need to do. That there is no new updates on your speaking so far, and you can avoid all the cliches conversation what you are practice so far. So you can have some conversation which could help you to identify like how to make the listener to interact with your conversations. Can we use the proverbs during the conversation? So that's a nice question, Ankita. So when you are using the proverbs, if the situational is been good enough to have a proverbs, then you can use it. Otherwise, it is not been required, because sometimes if I'm saying yes, you can use some proverbs on your speaking. Definitely from tomorrow, all the candidates will have some proverbs during the conversation. And if that is not as per the situation, then that will be an awkward. So I'm not saying that you can use it, but if the situation has been helping you, or if the proverb is going to help you on the situation, then you can do that. Otherwise, better to avoid it. How to answer the question starting with an explain, find out, reassure, explain how to answer with the given question. So if you wanted a question starting with explain or find out, oh exactly, very good. So if your task is that explain so and so things, alright, or find out what's a patient have the symptom. So definitely, so you could say that, would you mind to explain me regarding your dietary habits, alright, or would you mind to explain me regarding your habits, alright. If you you can ask like, don't you mind if I ask you regarding on your habits? You can ask about it. Or it would be more helpful if you could tell me something regarding your habits, so I can have a better understanding about your condition. You can do that, alright. And then, is it okay to ask, is the right time to speak with you during the home visit? Oh, that is a very good question, Sandra, because most of the people, when we are on the home visit settings, the first few questions will be by hearted, alright. So that is they will be asking, is Mr. John's house, is I'm talking to Mr. John, is this the right time to talk to you regarding also and so things. All these kind of pre-filled stuff they will be throwing during the conversation. So I don't believe this is the right thing when you are during the home visit. So you are asking about, is this the right time, or is I'm talking to Mr. John, or is this Mr. John's house? All these kind of pre-filled question you can avoid it, because that is totally distracting the conversation, alright. So you can understand you are on the room now and you are with the John, alright. Now you can begin your conversation. That is always better. For example, well, Mr. John, I'm the community nurse on this nearby locality, and your doctor asked me to come and meet you to inquire about your symptoms or the current recovery, all this matter that you can ask about it, and directly get into the conversation. That is always better. So it is not be so good like, is this the right time? It is, you can avoid that, all those things. If your interlocutor is saying, okay, no, I'm not in the right time to talk with you regarding on this, I'm in busy or something, if he is talking, definitely the students may get panic, alright. So it is always better to save your place and to ask about your questions. That is always better, alright. And regarding the introduction or starting a role play, can you just summarize a possible situation such as you have just examined the wound? Alright, so Aaron, I guess I have discussed already. So if this description says that you have examined the patient, that doesn't mean that you are known to this case, or the patient or you are mutually familiar. It doesn't mean that, okay. If it says examined, the description says examined, and you have 2 or 3 tasks only to have a conversation, then what you can do that, you can continue. Because if I am the situations, I'll definitely do like, would you mind if I examine your wound? Okay, upon my examination, I have seen so and so things on your wound. I need to do so and so things. This will be doing, alright. And the description says that you have examined your wound and you have too much of tasks. For example, you have 8 to 10 tasks to explain. On the situation, what do you have to do that? If you are examining the wound, all this, definitely your time will be up, right? So what you can do that, you can directly begin like upon my wound exam, upon your wound examination, I can say that so and so things has happened. So what would we do further? So continue the things, and doesn't ever mean that this is a non-case. Okay. Fine. Okay. So is there any other question? So I always recommend that try to be confident when you are trying to be on your conversation, and always consider that you are a nurse and you are talking to your patient. Alright. So keep this, and this will definitely help you to do this. Alright. And I hope there is no other concerns, and if there is any concern, please feel free to contact us. We'll help you if there is any concern, and doesn't mind if you are given many time and you are losing your speaking subtest. Please come to us. We'll help you to crack your speaking examination or any other module if you have any such kind of a concern. Sandra, to what extent the health idioms are encouraged? There are health idioms can be used if the situation is being meeting or required that kind of an idioms, alright, that you can use, and never use any idioms which is not being according to the situations, then definitely you're in trouble, alright. So what I'm not recommending that kind of an idioms to the students, because they might be with the panic or anxious when they are on the examination, might be it can misplace. So always try to use a very common language which is which can be do it over there to enhance your speaking, or which could definitely enrich your speaking on this. And as I mentioned, like, if there is any concern, you can please contact us. We are right now at Mysore, Calicut and Kottayam, and if there is any concern, you may please reach us or any of the institution, and we'll help you finding on it. And we are also starting a crash course for those who are appearing for the nearby examination. And if you feel like you are much of worried regarding any of your module, you may please contact us, and we are the right people to help you on your examination, since we are promising the high range of results on your each of the exam. And we wish you all the very best, because the people are going to face their examination on the 27th of August. And still, if you are not confident to take your exam, you may please contact us. And I wish you all the very best for your future exams. And thank you for your active participations during these sessions. Thank you very much, and all the best for your future sessions.